Hi everyone, and welcome back to Tommy Talks Medicine, your answers in 5. Today we're addressing a serious topic, although the title may not seem so. My child made me a ticking time bomb. I'm talking about high blood pressure in pregnancy. It's something that's very, very important to discuss because complications such as preeclampsia are all too common nowadays. So, 5 big points, 5 short minutes. Let's go. Number 1. What is it? High blood pressure in pregnancy is a whole spectrum of diseases. You can have gestational high blood pressure, which is outside of pregnancy, your blood pressures are fine. But when you become pregnant, you start to have higher blood pressures. All the way up to something like preeclampsia, where you start to see the effects of those blood pressures on your organs, like your kidneys, your eyes, and things of that sort. Then you can also have something called HELLP syndrome, which is where you start to see drop in your blood count. And then you can also have eclampsia, which is where you have seizures that are associated with high blood pressure. Number 2, what are the consequences of high blood pressure in pregnancy? If your blood pressure is not well managed, you can have issues with your kidney function, you can be at risk for stroke, you can be at risk for seizure, you can even be at risk for maternal death. And these are just the mama side of things. On the baby side, this increases your risk for stillbirth, it increases your risk for early birth or preterm delivery, and it also increases your chance for having a baby that's smaller than normal or growth restricted. Number 3, what can I do? 1, attend all your OBGYN visits. It is very important because during those visits, they will check your blood pressure. And a lot of times for people who don't have a blood pressure cuff at home, that's the one place where they can get it consistently checked. And so it gives us ability to see if there's any increase in trends in your blood pressure, if there's increases to where we may need to give you medication, or if you're starting to have symptoms of things like preeclampsia or even eclampsia during or after your pregnancy. Next, I highly recommend you have a blood pressure cuff at home if you can afford one, so that way you can monitor your blood pressures during pregnancy. You don't have to go crazy taking them every 5 minutes, but it's just something to have, and your doctor will also instruct you on how frequently you may need to monitor depending on what you have. Next, look out for warning signs. I always tell my patients warning signs of preeclampsia are 1, if you have a headache that doesn't respond to Tylenol, 2, if you have blurry vision or you have spots in your vision, 3, if you have pain at the top of your belly, especially on the right side. These are all things to look out for as you start to go into later parts of your pregnancy and looking into the 3rd trimester especially. But be careful because these things can creep up even early in pregnancy, especially for people who have had high blood pressure before and were not aware of it. 4, the postpartum period and high blood pressure. Now, we always associate high blood pressure with pregnancy and getting worse in pregnancy, but I don't want you to forget that this can happen after delivery as well. Especially in the first couple of days to weeks after delivery, you can have a shift in the fluids that were previously making your legs swollen and your feet swollen, your hands swollen, all of that going back into your blood vessels, and that can increase your blood pressure and put you at risk for preeclampsia and eclampsia as well. So I don't want you, after you delivered your baby, to forget your blood pressure monitor and stop keeping track. The same things apply. Make sure that you're keeping track of them, and also make sure you're still going to your visits so that way we can pick up on anything if it may occur. Lastly, the point is your blood pressure matters. It matters before, during, and after pregnancy. And you may be at increased risk of blood pressures outside of pregnancy that may need medication. And so it's very, very important to keep track of this, very important to go to your doctor's appointment, and again, very important to monitor your blood pressure. Thank you so much for watching this video. I pray that you are healthy even as your soul prospers, and I'll see you in the next one.